Hi, I'm Al Geissele. I'm an orthopedic spine surgeon, and I've worked at EmergeOrtho in Hickory for just over 29 years. My background was in the military treating general orthopedic problems, but I did some extra training in spine surgery fellowship. And so now for the past 30 plus years, what I do is specifically spinal disorders. And today I think I'm going to talk to you a little bit about sciatica and its relationship to the spine. Yeah, so sciatica is a term that's commonly both used and misused. It's really meant to describe pain that radiates from the back down into the hip, thigh, and leg, and sometimes into the foot, based on compression of the nerves in your spine that comprise the sciatic nerve, hence the name. Those are typically the three bottommost nerves in your lower back, and inside your body they mingle together and form a network that comes out into your hip area. So a lot of people will start with hip pain in their buttock area and then eventually symptoms down the leg. In the beginning, most people will have some back pain and often not have leg pain. But as sciatica in its classic form progresses, frequently there's a significant component of leg pain radiating from the hip, thigh, and down the leg into the foot as mentioned. As time goes on, this can become quite severe and entrenched. People have a hard time functioning. And so in the beginning stages, when it's mild, there are a lot of people that don't even come in for treatment or self-treat. And in our practice, we wind up seeing folks in all stages, but the late stages are the ones where in spine surgery and in orthopedics in general, we have the chance to make some of the biggest impact. The term sciatica is used fairly widely by people to mean pain going down their leg, and it's, I think, important to distinguish between classic sciatica, which is typically due to a ruptured disc in your spine, where a piece of the jelly in the disc ruptures out and squeezes the nerve and causes it to be inflamed. That hurts in just about every position that people adopt in the course of their day-to-day lives. Some people will get sciatica from pinched nerves in their back due to thick bone or bone spurs, and that's something we see more with aging, and in that case it is more positional. So in other words, when you're standing or walking, that tends to squeeze the nerve a little bit harder, and those people will have symptoms that mimic the sciatica from a ruptured disc, mostly when standing and walking, and they get relief when they sit or flex forward at the waist. So in a way, while not strictly sciatica by the classic definition, in some cases I'll call that positional sciatica, such that what position you're in affects how it behaves, versus classic sciatica, which is for the most part position independent. So there are a lot of conservative treatments that are available for managing pain and day-to-day mobility when you have sciatica. In fact, the classic treatment in the beginning is to really just keep people comfortable, because 80 to 90% of people get better with virtually no treatment by 3-4 months at most. So simple measures to include Tylenol, over-the-counter anti-inflammatories, and then when you come to see us in the orthopedic clinic, prescription anti-inflammatories are often used. Many times we use oral steroids or cortisone type preparations. You'll hear people commonly refer to these as prednisone or other variations on that theme. Those are helpful to reduce the inflammation in the nerve. Sometimes we'll give steroids by injection into the muscle so that they can leak out into your circulation for a couple of weeks and saturate the nerve that's inflamed with really potent anti-inflammatory material. One of the hallmark treatments conservatively for sciatica is also physical therapy. And with physical therapy, we can take your back and your core area and train you and it to function better and try to aid in the healing process, relieve pressure on the nerve by various stretching and exercise maneuvers, and hopefully help you feel better and facilitate the natural healing process that your body wants to adopt on its own. We try to get everyone to let the body heal itself when they have sciatica. That's the best approach really for all of us. Sometimes the pain is so severe that people can't tolerate simple measures and make it long enough without more detailed intervention. Sometimes other things take place, such as when all the nerves to the bowel and bladder area get pinched, and that can cause a surgical emergency. And sometimes there's weakness or difficulty with moving the legs that kind of forces our hand to think of or conservative measures as being finalized and not successful anymore. In cases like that, or in cases where simple measures haven't controlled the pain, even if it's not that drastic, or one of those drastic measures don't show up, then we start thinking of surgery, and we try to make that at the point where the body's tendency to heal itself is no longer really going to be successful. Oftentimes people come in and are worried about getting nerve injury if we don't do something quickly. The pain is severe, the source is unclear, and it's very frightening to people. And so there's an anxiety about getting nerve damage or permanent changes in the function of the sciatic nerve. In some people, if you wait too long, there can be changes in the nerve that don't get better, even with surgical treatment, what in layman's terms we would call nerve damage. Not everybody is susceptible to get those. It turns out that people with background nerve disorders, what we call neuropathy, or other medical nerve illnesses have a greater predisposition for that to happen and for it to happen earlier. But in the average person without those conditions, where the nerve tissue is healthy and the metabolic function of your nerves is okay, we really don't start to see permanent changes occur in the nerve where delaying treatment would potentially put you at risk for a long-term delayed recovery or lack of recovery, usually until things have been going on for about 6 months. Sometimes the pain and the problems people have when they're having back trouble in general and sciatica in particular make patients very afraid. They're worried about what's going to be discovered. They're worried about what's going on. They don't understand the process of treatment that well. And of course, most people tend to remember the worst case scenario they've heard from their friends or family. At EmergeOrtho, we try to treat everyone with the same degree of concern and care that we would our own families. We love to see folks that have had some prior treatment, but if you have had sciatica symptoms and have not had prior treatment, that's perfectly fine. We're able to start out with the basics right from the beginning. If symptoms are severe or not severe, it doesn't matter. You can call us anytime and come in to see us at EmergeOrtho, and we'll do our best to get you along the path to healing.